typically what is normal blood sugar levels post-delivery, and how is it different for women who've been diagnosed with gestational diabetes?
After the delivery, the gestational diabetic mothers, their blood sugars come back to normal.
Mm,
So majority of them, they don't require medication,
mm,
particularly these gestational diabetic mothers, unlike the pre-gestational diabetic mothers. So
right.
we put them on the normal diet. We don't tell them to restrict because they're breastfeeding the babies. And we check the blood sugars, but we educate the mother that she requires another test between 4 to 12 weeks post-delivery to look
Mm,
at their oral glucose tolerance test. If it is normal, but we need to tell them to do it at least once in a year, because there is a tenfold increase of
right.
developing diabetes, as Dr. Usha mentioned, in the later life, and it increases in linear proportion at the age of the mother. So by 10 years after the GDM pregnant mother, 20% of them can become diabetic. So in the gestational diabetes, usually the blood sugars, they come back to normal after delivery because
Right. Okay. Okay. And you said, but if somebody had undiagnosed diabetes, which only got diagnosed during pregnancy, or they already had diabetes before pregnancy, then how does the blood sugar still come back to kind of normal, or it goes back to that what was the state before the
uh,
pregnancy?
they will require medication. They don't come back to normal post delivery,
Mm,
and they will definitely require medication. But 30%, 37, 30 to 32% of the insulin requirements prior to pregnancy, what they need. So we need to cut down and titrate the insulin dosage or the medication for them. They are
mm,
not completely normal. We need to
right.
monitor the sugars to at least 24 hours after their diet, and they require a modification of their diet too.